Well, good morning, good afternoon now, and welcome to the Flint Community Webinar on Coronavirus. Thank you for joining us today for this 83rd session of the webinar. And just as a reminder, we started this webinar to bring a local context to a global pandemic. As we've journeyed through these 83 weeks, there are a number of things that have happened, additions to our conversations. So we want to continue that. We've got some special things for you today, but we want to begin by saying thank you to all of our partners who joined us. And if you're looking, if you're actually in the webinar, you can see the number of partners that we have. I want to remind you that we have panelists that are waiting to answer any questions you have about this array of issues that we have been facing during these last few weeks. Just to give you an idea of who is available for us today, we have representatives from the Genesee Health Systems, from the Greater Flint Health Coalition. We have representatives from the Genesee Health Plan. We also have representatives from the Genesee County Health Department. And so please remember to put those questions in the Q&A, and we will be happy to answer them for you as we go through the webinar. Today, we have a very exciting webinar for you today. One of the things that you're going to get a highlight of, we call it community voices. There have been a number of community members, our community health workers, as well as social workers that have been behind the scenes working in our communities, and we want to have you hear from them today. We last week started exploring some public health terms. We're going to do an additional exploration today, as well as talk about adult vaccination schedules. You're going to get a very, very exciting medical moment again today, and you'll hear updates from the Genesee County Health Department, as well as the governor's office and the city of Flint. So stay tuned. And if you are listening today, please remember to invite someone else to come along and be a part of this webinar today, to join us to get this incredible information that we're going to share today. We also want you to know that you can give us a call at 810-835-2130. If you have questions, give us a call at 810-835-2130, or you can send us an email at info@hfrcc.org. We're going to jump right in today and start off with our representative from the governor's office, Gary Jones, who is here every week unless he has some absolutely emergent issues that he cannot be with us, to give us that update directly from the governor's office. Good morning, good afternoon, Gary. I'm still on morning time. Good afternoon, Gary.
I mean, it's only been afternoon for like 3 minutes, so I'm not gonna fuck you too tough on that one. So good morning, everybody. So the bridge card system will be down this weekend from approximately 11 p.m. Saturday to 11 a.m. Sunday. Residents who receive food assistance, cash assistance, and women, infant, and children or WIC benefits loaded on the electronic benefit transfer or EBT cards will not be able to redeem them during those hours. They can use the same cards beginning again at 11 a.m. Sunday without any effect on their benefits. Benefit balance information for all programs will be available at 11 a.m. and the transactional history will be available by 3 p.m. These system changes will improve access to food and cash benefits because people now will be able to use a mobile app that was not previously available. The agency apologizes for the inconvenience and chose a time frame with low bridge card activity to make this transition. All Michigan families who are eligible for food assistance benefits are receiving an additional monthly payment in October in response to the COVID-19 pandemic, per the Michigan Department of Health and Human Services recent announcement. Building on her My Safe Communities plan to reduce violent crime, Governor Whitmer announced that police agencies across the state of Michigan will receive additional funding to boost public safety initiatives. The Michigan State Police was awarded $182,000 grant to support de-escalation training through the United States Department of Justice Community Police and Development De-Escalation Training Program, which Governor Whitmer advocated for earlier this year. The governor also recently signed an executive order to establish the Health and Aging Services Administration within the Michigan Department of Health and Human Services. The newly established agency will provide more coordinated services to Michigan's growing aging population by combining the former MDHHS Aging and Adult Services Agency and Medical Services Administration under one umbrella within MDHHS. Michigan's Medicaid office is also part of the new Health and Aging Services Administration. Also, and finally, I would like to present the governor's statement regarding the passing of Dale Kildee, a former Michigan congressman and state legislature. The governor is quoted by saying, Congressman Dale Kildee was a tireless public servant and proud Michigander. He served his community in the state legislature for over a decade and in the U.S. House of Representatives for 35 years, where he advocated fiercely for the automotive industry and workers, led successful efforts to reform education, and expanded access to financial aid for college. Dale started the Native American Caucus in Congress and admirably represented mid-Michigan during his time in office, uplifting local families, communities, and small businesses. He served students in the classroom, his community in the state capitol, and constituents in DC, where he rarely missed a vote in 35 years. A lifelong Michigander, his passion for working people was clear in the work he did every day. He made our state and country a better place. My thoughts are with his family, including his nephew, Congressman Dan Kildee, who succeeded his uncle in the U.S. House of Representatives. Dale, we miss you. And finally, as always, would like to end by saying michigan.gov/COVID vaccine, as well as michigan.gov/coronavirus, still the best catch-all websites to keep updated.
Thank you so much, Gary, for that. And of course, we do also share with that family in this loss. It was a he was a great advocate for our community for so many years. So we appreciate the work that he did and look forward to remembering those things that he did and holding up that banner. So thank you. So we are now about to engage in a very interesting conversation with our roundtable. We're going to ask Dr. Lawrence Reynolds, Dr. Pam Hacker, Dr. Deborah Verholden to come and join me in this quick conversation. Dr. Wilford, you're also welcome to join us in this conversation. And we want to start off, Dr. Deborah, last week, I asked a question when you were doing the policy brief update. I asked you a question about endemic and pandemic. We had a lot of good, look at you, Dr. Deborah.
I have an assistant today. I have an assistant.
so that was surprising. But we got a lot of good comments about that conversation. And so we thought we'd explore a little bit more about some public health terminology. And in our conversation, you made me aware of a new term. So we heard about endemic, epidemic, and pandemic, but you brought something new into the conversation last week after our meeting.
Yeah, and that's a syndemic.
Okay.
A syndemic.
A syndemic.
A syndemic. And that's where you have two or more epidemics happening at the same time. So people, in my world, we do a lot around behavioral health, and we had an opioid epidemic that predated COVID. And guess what? We are still in the midst of that opioid epidemic. And lo and behold, what happened is COVID made the effects of the opioid epidemic even worse. It exacerbated the problems. People had disruptions in their treatment and in their care. And so the opioid epidemic was made worse by the ongoing COVID pandemic, which is a worldwide epidemic, and you call that a syndemic. And like Dr. Hacker's point, the reason that it really becomes relevant is because of all the great care, medical care, and other things that we have available, it becomes overly burdensome on our system. And lo and behold, at a time when people would need care the most, the system is the most stressed and not able to meet everybody's needs.
So Dr. Hacker, this is a good place, when you think about the role of the health department in all of this. So how does this affect, when you go again, that syndemic, epidemic, pandemic? Help us understand how all of this impacts where we are as a community.
Oh, there's so many things that are involved in response. And just as Dr. Verholden had said, the opioid epidemic, that affects, it affects like the treatment availability. It affects people being able to hold down jobs, and in times of stress, it's easier to relapse. and it increases violence. I've spoken with a couple primary care physicians in the city of Flint, and they said they've never seen this kind of violence level. And one's been there like 7 years, one's been there like 20 years, but they said they have not seen this before. And so, domestic violence is also at epidemic proportions. So these all fit together, and it also affects the messaging. Is if you are having personal crises, it's a hard thing to find time, which seems hard to believe in some cases, but it's true. You just can't find the time to go out and get the vaccine. So people are being hospitalized, people are dying, who say, it's not that I was against the vaccine, I just didn't have the time to do it. And we have to believe them, and we have to meet them where they are and in any circumstances that would help to allow it to be easier to get. So I know Aurora is on here too, and her team has been incredible in doing that exact thing.
Yeah, so Dr. Hackett, I just want to review these terms again, just because sometimes we hear all these things on public communications, national news, and they're saying these terms, and to make them make sense for us. And so a syndemic, as Dr. Deborah is saying, is two or more issues happening at the same time. And Dr. Reynolds, you might want to chime in on this too. So we went from flu we talked about for so many years. We talked about the water crisis, and we talked about opioid crisis, and we're talking about now COVID. Oh my goodness. And so as a chief health advisor, just to quickly, how does all this, from your perspective, how do you address this from your perspective?
Well, it's through policy, it's through advocacy, it's through adequate funding. We have to make sure our public health services in the county are adequately funded and that our leadership get that support. That's most important. And then we have things that exacerbate the syndemic further. It may be part of the syndemic, and that's an issue of housing. When folks are facing eviction or doubling up or tripling up because of eviction, we have to address that. And so this pandemic, syndemic, is no joke. And as I've said before, everybody says we want to go back to normal. And what I insist upon is normal was never good enough. We have to do better. And this is part of our path.
So thank you, Dr. Reynolds. I want to go back to you, Dr. Hackett, real quickly, because we've been talking about the public health system, and every year, at this time of year in particular, we're talking about flu vaccinations. And I know that the health department has been very helpful in this, making sure everybody has access to vaccines and all of the different locations that are available for the flu vaccine. But we want to have a little bit of quick conversation about the adult flu vaccination schedule. And I want to just give you an opportunity first, and then Dr. Reynolds will share some more about the importance of the flu vaccination schedule. And we do have some information for people once your conversations are done.
So we do encourage anyone over the age of 6 months old to get their flu vaccine. It is particularly important for pregnant women, and that way they pass on the antibodies to their babies so that protection lasts into the first 6 months. And we have, a couple different varieties. There's the higher dose, which is for, older people. But if that's not available, the regular flu vaccine is terrific. And it is so important right now because we have already had confirmed case this flu year, which begins October 1st, of influenza in Michigan now. And that's a little on the earlier side. It's influenza B, and normally at this time we may be starting to see influenza A. So we had a year with very low flu. I think it proved all of the people who are saying, COVID's not worse than the flu, wrong, because masking stopped the flu last year. Our death numbers were, I think, below 2,000 for the country. And we know what, devastation COVID-19 had. So that's just an indication of how much more severe COVID-19 is than the flu. You want to get both of your vaccines, flu and COVID, though, so that when you are having some symptoms, it's easier for them to rule out that it's not influenza and to be able to get you the treatment you need, particularly like the monoclonal antibodies for COVID, if that's what it is. You do not want to have anything delaying proper treatment if you do have a breakthrough case of COVID.
Thank you, Dr. Hacker. Dr. Reynolds, again, this is a near and dear to you.
Well, I'm going to speak as a recent grandfather in the past 4 years and all the ramifications that come from there that Dr. Hackert touched upon. It is essential that we as seniors, as grandparents, aunts, and uncles get properly vaccinated for pneumonia, for the flu, for zoster or shingles, that we get vaccinated for influenza as well as for COVID, because we do not want to transfer this to our family, friends, and loved ones. And that is most important. And the reason folks get so upset about how they're going to respond to COVID is they did not understand how effective the vaccines were in preventing some of these problems, like diphtheria, whooping cough, tetanus. So we just took these things for granted that they were gone. And no, they were not gone. They were suppressed by vaccination, immunization at the appropriate time. So say you're over 65 like myself and you can't remember your immunizations from when you were 21. Get them. If you say, well, I don't want to take the chance, ask your doctor to check the antibody levels for measles, mumps, because some of us were only children. Some of us were years separated by our siblings. And when we asked our parents, they said, well, all y'all got it, but it's not necessarily so. So we have to be diligent about this. And then you can go to the health department, you can go to your physician's office, and sometimes you can go to the pharmacy. Now, here's another lesson I'm learning as a senior, and that is, does your insurance cover everything? You need to check with your health plan to see what is covered completely, what is covered partially, and what is not covered at all. I have a younger brother who just became a senior down in Detroit who has a health plan. And when he went to get his shingles shot, he was told, well, that'll be $187. And the story was they had classified the shingles shot as a treatment, not as an immunization. And I share this with you so that you check with your plans and be clear on what is covered by your plan and what is not, and then make a plan how you're going to get this done. And then you can seek assistance. Federally qualified health centers will provide services for you on a sliding fee schedule. And now I'm creeping into the Genesee health plan area, but this is why we did all these things.
Exactly.
This is why we pay taxes to have a Genesee County Health Department and a health director and all her staff. So please, let's act our age. We're not 41 anymore.
All right, keep reminding us, Dr. Reynolds. Dr. Hacker, I see your hand up as we prepare to transition to our next panel. Dr. Hacker.
Just a brief thing on if people are concerned about if you got the vaccine or not when you were young, should you get it again? Do you wait for the titers that would cost as much, if not more, than the vaccines? Because Dr. Reynolds is completely right. Like it is so critical to get these vaccines. And I personally have just a real quick story is like I had some of those childhood diseases. When I started at Oakland County, I had the titers drawn because that was their policy. They were all fine, but they lost those. So then when I was doing my fellowship 3 years ago, I just said, just give me the vaccines again because they are safe, they are effective. And I knew I was getting way too much of the vaccines. And I don't mean to be cavalier, but it's like, I knew there was, at most I was going to have a sore arm. So I really do strongly encourage people, if you wonder if you had it, you can't find the information in your family to confirm you actually did, please get those vaccines.
Thank you, Dr. Reynolds and Dr. Hacker, Dr. Deborah. We want to just quickly show you that there are vaccine schedules available to you. You can go on the CDC website, and we often give these websites, but we thought today we put these in the webinar for you so that you can go back and look at the webinar and retrieve these. So we want to look at those vaccine schedules that will be available. There's this a recommended adult schedule. There's 2 others that we put in the webinar today that will support what has been said by our panelists. Table 1 and table 2. So when you get a chance to go back and look at the webinar, pay close attention to those particular slides. We want to now, as a result of the webinar every week, we had community health workers and social workers request continuing education units, and we have community voices here today. I want you to hear from these individuals. Aurora Susset, who is the program manager for Michigan United, is going to talk with us. Cassandra Hubbard, who is a community health worker at the Genesee Health Plan. Gwendolyn Smith-Richardson, who is a health navigator for the Genesee Health System. Heather Shunter, who is with the CHAPS program at the Greater Flint Health Coalition. Also, Janet Poole-Little with the CHAP program at the Genesee Community Health Access Program. Latrice Gordon, who is a public health navigator for Michigan United. And then we also have Perlita Irish, who's a bilingual community health navigator for Genesee Health Plan. I'm gonna ask them all to come on and open up their cameras so we can see your wonderful faces today. And this conversation, we're going to just go some really rapid fire. I want you to know now, as they're getting ready, please put your questions in the queue if you have any. We do have representatives that are waiting to answer those questions for you. Now, they're all smiling, and I know they're wondering who I'm going to call first, but I want you all to get ready. I'm going to ask Aurora. I can't, oh, there she is. I see you, Aurora. All right. So I'm going to ask Aurora if she would just get us started. She is responsible or managing the Michigan United Section 4 program for us in this area. And Aurora, are you there?
Yeah.
Okay. Can you open up your camera so everybody can see you?
Sure.
There you go.
Okay. Can you see me or no?
No, we can't see you yet, Aurora.
No, sorry here.
Okay. So
okay, there we go. Start video.
Yeah, so Aurora's been in our community for a long time and making sure that information gets out. So Aurora, while you're waiting, I'm gonna go to Latrice. Latrice, you're also with Michigan United.
I'm actually ready if you and I only have like a little spiel. I just want to let everyone know, actually, first of all, who Michigan United is. We're a nonprofit that we build power in our communities that need to win the justice that they deserve. It's a coalition of labor, business, social service, and civil rights members all across Michigan, with offices in Detroit, Grand Rapids, and Flint. And we work for an equitable and sustainable world that reflects our values of economic and racial justice. And so our public health navigators are grant-funded community educators, and they are making a difference in Genesee County. And by the way, our Flint navigators are all required to attend this weekly webinar as part of their job duties. So I feel that this is one informational stop that is very helpful for everyone, not only community members, but community leaders. And so what we do is we bring the COVID-19 information to the community. We dispel false information about COVID-19 in the vaccines and transmission in a culturally competent way, which is very important to keep in mind, because it's easy to just say we're given information, but if it's not culturally competent, it makes it very hard for people to receive that information. And so we also give up-to-date resources to the communities that need scheduling and testing information and much, much more. And that much more includes the access to the vaccine through the team of nurses that we have been able to bring on board. And so we're really proud to mention that Michigan United has very quickly gained momentum, and we have been able to bring 5 extra nurses on board. And so I'm really honored to go ahead and turn it over to Dr. Latressa, who is our nurse coordinator for Michigan United. Thank you.
And thank you, Aurora, for giving us that background. And so, Dr. Latricia, as you prepare, I'm going to ask this one question. Well, actually two. And everybody just chime in when I call your name and answer these questions. So Aurora has told us some of you are here because they're asking you to be here every week, but others of you have joined. How has this benefited you and those you serve? And tell us the agency you're from and how has this benefited you and those you serve? Latricia, Dr. Gordon.
Hi, greetings, Dr. Latricia Gordon, the Flint Public Health Nurse Coordinator under Director Dr. Campbell Hacker. Since June, we started an initiative to go out in the community to take the vaccines to the community. We've done porch fest, we've gone into people's homes, we've actually meet people where they are. If they call us, we'll come. We've vaccinated people on the corner that were transient. So currently, we have a team now put together of 5 additional nurses, including myself, that puts on mobile COVID vaccine clinics to have accessible vaccines to people that look for jobs, meet them on the corner. Also, to churches. We've had probably over about maybe 30 events from June until now, but a pretty much great success of vaccinations among the community. And so we just have transparency and build the trust within our community.
Thank you so much. I'm going to go over to Gwendolyn Richardson from Genesee Health System. Gwendolyn.
Hello and good afternoon. Definitely everything that you all mentioned in the very beginning of this webinar is the reason why we tune in every week. We are actually at Genesee Health Systems in the Water Department's Family Navigation Department. We're actually working hands-on with those community members, with the consumers who have, as Dr. Verholden stated, many of those consumers have been dealing with the opioid crisis, the Flint water crisis, the flu epidemic, and then on top of all of that, this pandemic and the generational disparities that our families were dealing with before any of that happened. Dr. Reynolds mentioned earlier that normal pre-COVID wasn't good enough. So as we were dealing with all of that, we're trying to just help our families navigate through our systems that are sometimes more complicated than even we have to become specialists for. When the opening page of this webinar shows a great vast amount of resources that are available in our community. And many times I mentioned in settings like this, we don't often know how fortunate we are, but it's better when we work together, when we can provide those resources in one place and I can tune in every week and get the information to share with the rest of our team and our families. Our families are struggling well beyond what we can ever imagine. Recently in our community health worker training, we completed windshield surveys. And even after we've been working with families throughout the water crisis for the past 7 years, throughout this pandemic, the windshield surveys indicated to us the need is even greater than we realized. So although we've done lots of wonderful work, we've got lots of work to do. And this webinar provides a great opportunity for us to get all that information in one space at one time. And it gives me faces so that I can pick up the phone and call you. I can call Sherelle at the health department. I can call Janet at her, at her place of support as well. So it provides us with that outlet, which is so desperately needed for our consumers.
Thank you so much. I'm going to go right over here to Heather. Heather, you're with the CHAP program.
Yes, hello. I'm with CHAP, the Community Health Access Program. We are part of the Greater Flint Health Coalition. What we do in CHAP is try to provide health equity. So we try to ensure that everyone can have access to a provider, that they can have access to insurance, and also working through, the social determinants of health that may get in the way of people having access to healthcare, whether that be transportation, food issues, things like that. What this webinar has been so instrumental for us here in CHAP, because also as part of that, we try to provide outreach and education throughout the pandemic, starting with COVID-19, and then working through providing that information about the COVID-19 vaccine and trying to make sure that everyone has access to the vaccine and that we can try to help provide them with, access to accurate information, access to that health provider. So it's so great to, tune into this webinar every week because we can get that information that we can help relay to the community, as well as it's relevant information to our community as well, which is so great. It's, it's specific to Flint. So we also have some of our CHWs going out on a mobile vaccination unit to try to, help increase those vaccination rates and provide education and outreach as well. So this is really instrumental in just keeping all of us here at CHAP, up to date on, what's current here in Flint.
Thank you. Now, Janet, I see you nodding your head. You want to chime in right now?
Well, it's just ditto to everything she said. But, I tune in weekly as much as I can because, as Heather said, the information that we receive here is really helpful when we're working with our clients. The COVID-19 is new to everybody, so we're all learning together, and we're trying to get that information out to our clients as we speak with them. And we're up against a lot when we're dealing with the COVID vaccine, specifically because you have so many things floating around in the community. People hearing, this myth and that myth and magnets under the skin and the government caused it and the government is trying to, so we're trying to squash those and really get some good information to the people so that they can make well-informed decisions about, whether or not, anything where their health is concerned, that they're making good, well-informed decisions.
Thank you so much, Janet. I'm going to jump over here to Cassandra Hubbard from the Genesee Health Plan. Cassandra, so why do you come to the webinar?
Well, I come to the webinar. You guys just give great information. I am one of 15 other community health workers at Genesee Health Plan. And we're in the Flint Public Schools and some of the charter schools. So when we service our clients, we want to make sure that we have the most up-to-date information so that we can pass that information on to them. And I always try to make sure when we're doing our health assessments that we don't forget, even though the COVID is still going on right now, how important it is to get other services done, like the flu vaccine. Right now we're in, this is breast cancer month, how important it is to continue to get your screenings done. Even though we got all these things going on, it is still vital that we get all the other services done as well. So I always enjoy the information that you guys give. I pass it on, and I'm sure the other community health workers do as well.
Thank you so much, Cassandra. And we're going to round this out with Perlita Irish, who's a bilingual health navigator. Perlita.
Buenas tardes, everyone. That's good afternoon, everyone. I'm just really happy to be here. Thank you for the invitation. I've been joining the webinar because it's it is a great service to get the information out there. No, people don't get it mistaken. They're hearing it from us and they trust us. I work as a bilingual health navigator in our Genesee County. As you guys know, our Latinx community, we face significant barriers to accessing the opportunities that we need to be and to stay healthy. So our priority is providing the services to them during this pandemic, doing a lot of interpreting over the phone. That was challenging, but I guess everybody is becoming a pro at that right now. Getting people vaccinated, as you guys know, We had Our Lady of Guadalupe where people were getting vaccinated, but not everyone goes there. So we have, our community is everywhere, right? So a lot of them go to Ascension, Hurley, all over. So my job is to make sure that they had a guide, myself, to make sure they got to the appointment, they get the vaccines, they had no fear, and not being able to fill out the paperwork, because a lot of those barriers keeps them from that. And working with MTA to make sure those transportation services were provided to individuals that had no health coverage. So for me, it is important to attend, just to stay on top of everything. Like Gary was saying earlier about the food stamps. I'll be getting messages of why my food stamps are not in place. So for me to have an answer for them, it's very rewarding. I'm so grateful to Genesee Health Plan to have me as a bilingual health navigator and be able to provide the services to our community.
Thank you so much. And thank you all on this wonderful panel. I know there are more services that you provide at your individual organizations, but we did want to hear from you today because you're getting social work credits and you're also getting the community health worker credits. And it's because of your ask that we were able to do that, working with our partners at Michigan State University and the Michigan Community Health Worker Association. So thank you, and stay tuned because we're coming back. If you have questions for any of them, please put those questions in the queue, because we've talked about getting good information. And Sherelle is here from the health department to make sure we have the most up-to-date information from the health department. Sherelle.
Good afternoon, everyone. And thank you for having us every week on your webinar, because we're able to get information out as well to our community. I just wanted to start off by giving some current statistics of where we are with our vaccinations and where you can get your vaccine. Next slide, please. So as you can see on the screen, we have administered over 350,000 doses across Genesee County to our residents. Right now, 46.7% of our residents are fully vaccinated, and those numbers continue to rise. Next slide. And we do want you guys to continue to come out and get your vaccine, because we are seeing an increase in our trend cases weekly lately, which is not that great. Our data shows that there's been a 4.3% increase in case trend over the last week. So we encourage you all, if you have not been vaccinated, come get your vaccine. And again, we are offering the booster dose for Pfizer as of now. You must have gotten your first 2 shots at least 6 months ago before you can receive the booster dose of Pfizer. And then we have our 3rd dose of Pfizer and Moderna, which is only offered to our immunosuppressed individuals. Next slide, please. So in case you didn't know where we were, I'll remind you that we'll be at Our Lady of Guadalupe Church on Tuesday. Wednesday, we'll be at Central Church of the Nazarene, and Thursday, Shiloh Missionary Baptist Church. All 3 of these clinics are standing clinics, so you can find us there every week on those days at the times listed on the screen. This Saturday, if you weren't able to make it to a clinic during the week or can't, next week, we are actually partnering up with Michigan United, and we'll be throwing a clinic at New Creation Church of God, and doors open from 9 to 12 this Saturday. So come out, get your vaccine. We'll have Moderna and Pfizer. And next slide, please. You guys still there? Okay. Yep. So also, not only do we offer vaccines at our clinics, but you can get a vaccine at your local Walgreens or Rite Aid. You can also get testing at your local Walgreens, Rite Aid, Hamilton Community Health Network, as well as Word of Life Church, Bethel United Methodist Church, and Macedonia Baptist Church. Those 3 churches that I named just now, they are also offering the Pfizer vaccine. So you can get tested and you can get a vaccine right at the church. They offer rapid testing and PCR. So if you need a vaccination and you can't make it to one of our clinics, you can go to any 3 of those churches. Bethel United is open a little later in the day until 7 p.m. for those who have early morning things to take care of. And then lastly, we do want you to know that we take care of our residents who are homebound. So if you have any family members or neighbors who can't come to any of the walk-in clinics or go to any of the churches or pharmacies, we ask that you give Genesee County Health Department a phone call at 810-344-4800, or you can visit gchd.us to get your name put on the list so that we can come out to your home. And it does look like the FDA did approve Moderna for a booster dose, so we should be offering those very soon, next week.
Thank you so much, Sherelle. A lot of good information. And one of the things we talk about is test. It's so important in order for us to know where we are as a community is for people to get tested. And we have these wonderful testing sites. Now, in addition to having the wonderful testing sites, we received a lot of questions about the different types of tests. You said the PCR and you said the rapid. So Dr. Susan Wilford is going to come and give us some insights on these tests, the different types of tests and what we're looking for. Dr. Wilford, good afternoon. You're on mute, Dr. Wilford. Wonderfully already going.
Good afternoon, everyone. Thank you so much for this opportunity to share a little bit about testing. So what I want us to think about today, we're going to have just a little demonstration about testing. So when we think about tests, there are many ways to try to categorize them, but one way is by what they test for. The other is how they're testing, how we test. But if we think about what they test for, let's think about the apple. One type of test tests for things on the outside of the apple. As you might imagine, that's the rapid test. It can quickly get to what's on the outside, like you might be looking for a stem. It's easy to find, easy to test, easy to get an answer. And that's our rapid test. Well, that's our antigen test, let's say it that way, because we're talking about what they test for. And then if we think about another kind of test, rather than looking for what's on the outside, we would look for what's on the inside. And you need much more skill. And it takes a little bit harder to do because we have to get what's on the inside out. And so here we core the apple. And if we take what's on the inside out, then we can get to the seeds that are in the middle of the apple. And we can we can find the seed and test for that and see if that's present. And then we know that we have an apple. So with that in mind, we're going to talk a little bit more about this testing as it relates to COVID. And so with that, I am going to share my screen so that we can talk in more detail about the COVID testing. So as I mentioned, hopefully you guys, I hope you're seeing my screen there. We can test for different types of things. We can look at tests by how they test. And one day we'll talk about that in more detail, but we can look at what they test for. What are they looking for? And that's what we're focusing on today. So when we think about what they look for, there are 3 types of tests. First, the antigen test. Remember, that's like looking for something on the outside, like the stalk or the skin, something on the outside. Then there are the genetic tests. They look for something on the inside. That's like trying to get at that seed in the middle of the apple. And then you can test for antibodies. Remember, our body makes these antibodies after a while, and they you can test the blood for that. That's like, I don't know, waiting for ants or fruit flies that come in to attack the apple. So those are the three different kinds of tests that we have. If we start with the antibody tests, these tests, they are looking, as we say, for those antibodies in the blood. You'll know you got well, most likely you had an antibody test if they had to draw blood to get it. And what we need to do is to remember that it takes time for those antibodies to form. So if you got COVID or exposed to COVID on one day, it really takes about 2 to 3 weeks for enough of that, those antibodies to be present in the blood so that when we test, then we would find it. So you really want to wait 2 to 3 weeks if you wanted to get an antibody test, if for some reason you needed that. As you can tell, that's not terribly helpful when it comes to finding out whether somebody is infected and spreading it, right? Because you have to wait too far down the line to get those answers. So that's the antibody test. Then if we look at the antigen test, that's the one looking on the outside. So this one usually is a swab, or it can be done by saliva. And again, if you get exposed and you get a test, you might want to wait. These tests, I don't say you want to wait, but these tests are more likely to be sensitive to tell us that you have it when we test on days like 3 through 5, because you need quite a lot of those proteins on the outside, the things on the surface. You need a fair amount of them to be able for the test to tell that they're there. So they're actually really good when you have enough of that virus present that you are spreading it. So if it's negative, if you got it too early and it's negative, that's not a problem. They're cheap, they're easy. You just get another one and it will turn positive when you have a lot of it and you're very likely to be spreading it. And then finally, we have that genetic test. Now, we've talked about these in great detail before. One type of genetic test is what we hear the term PCR a lot, the polymerase chain reaction. We've heard that PCR term. That is one way of getting this genetic material out. And in this way, the sample is sent to the lab, and then they get that genetic material in the middle, and they add a dye that helps to make and heat it and cool it, and helps to make a lot of the genetic material. So that is why even with a little seed, even with a tiny, tiny amount of that genetic material, we can find it, because the actual process of finding it multiplies it many times over. So you can find even a small amount. And then you add a dye, and the dye tells you, look, it's there, and we know we have COVID. So that is the gold standard. It can tell whether you have COVID or not, even with a tiny amount. But often we don't really need such to find it when it's such a little bit there, because maybe we're not really spreading it at that point, because it will stay positive a long time after, because all it takes is a very little bit that we need. So those are the 3 tests that are available, and your doctor can help you decide which one. But if you think that you might have been exposed, the answer is to go and get that rapid antigen test, cheap, easy, and it can tell you fairly early on whether or not you have been exposed to COVID, whether or not you have COVID.
Dr. Wilford, thank you so much. And as always, amazing. It's much, much clearer now. And we do have all of these testing sites available in the community. Please go and get the test. You need to know for yourself and for the community. Thank you, Dr. Wilford. That'll keep you on tap here. We quickly need to go to the city of Flint. Lottie Ferguson, our Chief Resiliency Officer. Lottie, what's the updates from the city? I know it's a lot going on.
There's always a lot going on with the city. I just want to point out that it's completely unfair that I have to follow Dr. But along the lines of what she talked about today, Mike Brown asked me, he specifically came to my office and asked me to share with the group today that the City of Flint is working in conjunction with the University of Michigan to monitor or do surveillance on wastewater for COVID. Monitoring this can provide an early indicator for the presence of disease in the community and can be used to track trends over time. This is very important as rates of testing increase or decrease. It can be detected in wastewater up to 7 days before infections lead to increases in clinical cases. An increase in COVID detected in wastewater can alert public health agencies to the potential surge of cases in a specific community and allow for additional precautions to be put in place to prevent the spread of the virus. And so he wanted me to share with you today that the City of Flint, thank you very much to Dr. Lawrence Reynolds, who helped push this issue. The City of Flint is working with the University of Michigan to test wastewater for the presence of COVID.
Well, thank you, Lottie. Now, you just kind of indicated a conversation we need to bring forward, because I think this whole notion of what that looks like and how that works is something that's going to be really important for the community to better understand. So thank you for that insight, and we're glad that this partnership is underway. Now, we want to now move to the policy brief. There's some really important information Dr. Verholden and her colleague, Mary Catherine, are going to bring to us now. Dr. Verholden.
Hi, thanks, Yvonne. I want to reiterate just a couple of quick points. COVID transmission rate in our county, people have been watching a lot of the national numbers. And nationally, the numbers are starting to go down. Michigan is not following that trend. In our state and in our county and in our city, rates are either slightly going up or they've stayed pretty constant, and they stayed constant and high. Specifically, we had an increase for the second week, and I'm saying the second week because that was only after a very slight drop during the week of September 19th, but we basically kind of stayed pretty high. Our testing positivity rate in the county is hovering around 11%. What that means is that about 1 in 10 people who get tested are testing positive. Take that number with a grain of salt, because it is only as good as the testing protocol is. So we don't want people to only get tested when they're positive or when they have symptoms. We want people to get tested as a function of their exposure. If you're out and about, get tested. I've been out. I'm going right after the webinar to get tested today, and I will be getting a rapid test. Thank you, Dr. Wilford. So this is what it looks like graphically. You can see Flint pretty much flatlined from last week. We had an additional 10 lag cases that came in last week, and that's week 83. This week, we've got pretty much the same numbers we had last week, and we've also got an estimated 15 probable cases. You can see in Genesee County, the numbers are going up. If you compare where the red bar ends, you can see that we've had a more than trivial increase in cases since we saw that slight little dip the week of September 19th. So to just be the broken public health record that I am, keep masking up, keep watching your distance, keep practicing that good hand hygiene, and get vaccinated. I've heard now for the second time this week of somebody unvaccinated, whole family contracted COVID. One person infected an entire family. And just so people know, most people, when they do contract COVID, get very fearful and very much want the vaccine. And you cannot actually be vaccinated if you are a known COVID case or have a known recent exposure. They don't want to give the vaccine to people who they think are COVID positive. And all of these people that I've talked to said they wish they got the vaccine. So I'm just encouraging people, get the vaccine. I'm gonna hand it over actually to Mary, because she's gonna highlight a very important. Yeah.
I need to ask you something real quick while you're right there, Dr. Wren. You said, Dr. Deborah, known cases and vaccines. You said they don't want to get the vaccines. Can you just give us quickly why that is?
When you get sick, your immune system starts to work and starts to do what it's supposed to do. So if you can imagine, you get the vaccine, which the goal of the vaccine is to get your immune system going and primed to be able to respond to COVID should you be exposed. Well, it's already in the process of doing that. So you could run the risk of kind of over amping it up too much. And we don't want to do that. The other thing I want to note for people, I heard another set of stories this week from people around reinfection. And a lot of people, their second infection is harder on them than their original infection. So if you have had COVID, once you recover, you then should get vaccinated. It will still help you and protect you and provide support should you become reinfected.
Thank you so much, Dr. Deborah. We'll have to delve into that again. There's more to come on
Yeah.
that one.
Yeah.
So this slide here, 1 year later, and it's worse. Mary Catherine's going to help us with this one.
Yeah. So right, this is pretty disheartening given that, right, we have the 3 different and effective vaccines to help against COVID. And we're still seeing, if we look at the spread from 2020 compared to 2021, not only is it worse, right, but you can tell by the different shades of blue that it's more dense in certain areas as well. So as we're dealing with a more transmissible variant and we're headed into the 2021 holiday season without mandates in place, and with schools being in person rather than virtual, that's super concerning, right? I do want to point out that with the county's vaccination rate, right, and we will have some people with this risk that will increase slower, which will likely lead to a lower peak, but the risk is still much higher for those that remain unvaccinated, and for those who are less likely to comply with known public health measures like social distancing and masking indoors.
Thank you, Mary Catherine. And I think we just want to reemphasize this. A year ago, we had a state of emergency declared. Our governor said, let's close the schools, let's close the restaurants, let's close the stores. And so people are at home. So we did not have that much interaction. Now, people want to go back to normal, is what we might call normal. And now we're seeing this increase. So when we talk about social determinants, we talk about health more than the absence of disease. All of these factors are critically important for us to think about. So again, going back to those protocols, let's continue to at least mask up, social distance, so that we can reduce this continued spread of COVID in our community. Now, Mary Catherine, you've got some more important things to share with us as we round this afternoon out.
Yeah, so I'm really excited to talk about some of the policies, of course, always that we have going on right now. So one of the things that I think is so important is that we've now, Governor Whitmer has now declared October Weatherization Month. And the reason why that's so important is because it may feel great and warm outside right now, right? But household energy is so important for good health. And when we talk about social determinants and affordability, we think about what inadequate household energy does and or the consequences it has on individuals, including increased morbidity and mortality. And we know, based on our social determinants, that minority populations are more likely to be impacted because of the higher rates of energy costs and therefore their associated health burdens, right? So what can policymakers do? Well, we definitely need them to join MDHHS and Governor Whitmer in raising awareness about weatherization, and not only that, but encourage people to actually utilize the Department of Energy Weatherization Assistance Program, which will help reduce household energy costs and they have several strategies to do that. But part of that is going to include ramping up funding to address these different and disproportionate energy burdens on minority communities. And so I did go ahead and link up that Michigan link to where people can find those services and what's covered and eligibility criteria. All of that is in the brief, right? So we always want to make sure people are signed up.
Right.
Yeah. And then we also are super excited about a recent piece of legislation recently passed in the Senate that would actually reduce the need for Medicaid prescription authorizations relative to HIV and AIDS medications. And this is always good when we see the reduction of barriers when it comes to people getting necessary care and treatment for chronic conditions, and it's especially during COVID, right? It's more important than ever to continue to knock those barriers down when it comes to health-saving measures.
Thank you so much, Mary Catherine. And you hit it where we're right out of time today. But I just want, there's some late breaking news. Please give me this 1 second. On this coming Thursday, the 21st, we talked about these other issues. There's a public health information meeting around Buick City. Please go back and look at this and try to be there. It's virtual 6 to 7:30 p.m. to learn more about what's happening on that property and the PFAS issue. We want to thank you for joining us today for this webinar. It has been a powerful and, of course, jam-packed. We'd like you to remember and thank all of our social workers, our community health workers for the work that you're doing. Continue to apply for those social work credits and for the continuing education units for the community health workers. And let us ask you, join us next week. Tell somebody about the webinar. We'd love you to continue to like us on Facebook, subscribe to our YouTube channel, Healthy Flint. Always send us questions or information requests to info@hfrcc.org or call us at 810-835-2130. Our time is up, but we appreciate you and look forward to seeing you next week. Have a great weekend.